fam, welcome to Player Street. Here is all about real life, real talks, and real parenting hacks, and tales and everything in between. Today we are going to discuss about cancer. This is something that has been so rampant in our country, and a disease that has become so common nowadays. And today I'm joined with the one and only clinical oncologist, Dr. Alex NYINGI. Karibu sana to our channel, and thank you for giving us time to have you here today.
Thank you, Maureen, for having me. How are you?
I'm fine, thank you.
Yes.
So today we have come here so that we can tell our people exactly what is cancer in the most simple and easy way anyone can understand, even if you're not a medic.
So thank you, Maureen, for having me. And your viewers, we hope you are going to learn a lot from this health education and discussion about cancer. Well, you asked me what is cancer. Cancer is a word that really scares people. So the moment you hear the word cancer, it's a giant in the society because it consumes a lot. So cancer is the process whereby you find cells multiplying uncontrollably in such a way that they deprive so much from the body, and you find patients becoming so malnourished. You find patients it usually has a holistic kind of approach.
Okay.
I'll use the word hallmarks of cancer. Hallmarks is the process of cells developing in such a way they are not able to be controlled by the body. They just signal themselves and continue growing and growing uncontrollably until the body is not able to function. It's not supposed to be functioning.
So these are cells that, in case I am supposed to have 500 billion cells on one finger, they multiply to 100,000 billions, which are not useful for yourself. So this is the point they become cancerous. Or how does it?
So cancer, from a very simple language, begins with what we call one naughty cell. This naughty cell may have developed out of stress from disease, may have developed out of mutation, maybe from genetic, maybe from nutritional lack of physical activity, and all those what have you. So this cell diffuses what we call signaling. The body tells your finger, please develop 1 billion cells. The cell goes, that particular cell now decides I'll not follow the rest. I'm going to develop on myself. So this cell now starts multiplying. Multiplying, that's what we call proliferation, uncontrollably.
Zinakuwa nyingi?
Yes.
Okay.
They become many. Now, you are not able to see what is happening in the cell. That is what we call the mitotic multiplication.
Yeah.
That is from the DNA. So this cell develops, brings another one, just the same way an ovum starts multiplying the moment it has been fertilized by a sperm.
Oh, growing.
Yeah.
The way a kid will grow from
the uterus.
Being an ovum.
Yeah. Yes.
So these cells start growing and they have their own way of supplying blood to themselves.
Now, that's where I was getting. Now, these naughty cells, after starting multiplying, they can't listen to the body.
Okay.
They develop their own blood vessels so as they can sustain the growth. They bring the oxygen, nutrients, the nutrients that are supposed, or elements are supposed to be in the system, or the compounds. So they develop their own blood vessels.
So at this point, is this where now these cells being many in the body, are they the ones that now make yourself become weak? Having so many cells, in a very simple term, this is where when you have so many cells, they're the ones that will make your body become weak because you're having more than you're supposed to have in your body, right?
Wow. Now, that's a very broad discussion.
Yeah.
Because some of these cells are not normal cells, remember? They are also emitting what we call waste products, which are toxins in the body. Those toxins are going to suppress the normal cells. They are going to make your body to break extra fats to get extra energy. Remember, they have built up extra blood vessels. These cells are still multiplying. The body has a way in such that when some of these cells go beyond the number of multiplication, they are supposed to be naturally destroyed. But these cells decline that, what we usually call in the medical world, apoptosis. So they decline apoptosis. So as they continue to grow from the primary area, so they don't get enough space. So they advance. Now, for instance, if it's in the liver, they advance. The liver continues enlarging. So if they continue enlarging, they'll find space for more. And remember, these cells are very naughty and notorious, so they will spread to other areas.
Also, this is the point where if someone had colon cancer,
Yes.
it can spread to other organs in your body, like the liver,
Yes.
the kidneys, and now they're spreading.
Yes. Remember, these cells are stronger than the normal body cells. Remember, they are not being destroyed naturally, so they're increasing on day and night.
Okay. So, in normal circumstance, a body, after, I don't know, I've forgotten, but there's a point where it gets to a point their cells are supposed to be destroyed and others are supposed to be made by your body.
Absolutely.
So at this moment, the cancer cells, they don't have a life, what is it called?
Expectancy.
They don't have an expectancy.
Yes.
Because
They are immortal.
And then we start growing other new cells.
Yes.
So these ones are just growing and growing.
Consuming more energy, consuming more nutrients from your body. So your body, the normal cells are continuing to be suppressed, but these ones have their own way. So they know we have blood vessels, so they'll get more blood, they will store more, they'll continue multiplying. So they'll know where to get the energy. So some of these cells, because they develop their own DNA and produce some of these toxins, that is why you find once a patient develops this, they will lose weight. You find a patient losing like 2 kgs in a week, or 10% of the total body weight in 6 months. So that's drastic weight loss.
I think you've heard it from us. Now you have gotten to understand exactly what is cancer in the most simpler way, and how those cells begin to drain your body to a point you see a person has no weight, like wamekonda kabisa, because there is so much energy that is being used in your body.
Yes.
Okay, I would have asked about...
That's very broad, because that is what we call nutrition in cancers.
Oh, now what?
Yes, it's also a very broad topic, which we'll also discuss at one point.
And also like how lifestyle affects all these cells.
Oh, yeah.
At what point you get your cells are starting to spread and become toxic to your body, and now you have cancer.
What we are supposed to understand from what I've said, the process or the hallmarks of cancer is this particular cell. Remember, the primary unit of a cell is the DNA.
Yeah.
We get DNAs from during conception, so that is inherited from our parents.
From either your dad or your mother.
Yes. We also get what we call mutated DNA. We also get some DNA that are already damaged during conception. So there is just a time bomb, and everybody has a DNA, and everybody. So whatever usually happens is different timing, different exposure. You are born healthy, you have one cell that is just waiting for some adipose, because you don't do physical exercise, you consume alcohol, you consume a lot of smoking. Smoking, remember, it can be new smoking or you can be a passive. Yes. So the cell is just waiting for that mutation. We call them mutagens. So, and from your germline, you carried that. So it's just waiting for anything to tilt it from the normal functioning, and then it can explode. And this can happen to anyone.
Oh, this is the point where, people have had, I think we're going to discuss that some other time, but people have this idea of, like, because you're eating these and you're from you have this different lifestyle, that's where you get the cancer cells. But if you go to even in the rural area, you'll find an old woman who has never consumed sugar, anything related to these processed food, they have cancer. So there's a possibility they carried a gene from their parent, and now at what point do they get exposed? Maybe they have eaten something,
so
now a big passive smoker or something.
Yeah. So I'm trying to come up in a way to make you understand. So I explained about this cell that can mutate anytime.
Yeah.
This cell can mutate due to factors that we usually call modifiable and non-modifiable factors. So modifiable factors is what you can modify in your body. You can smoke, you can take alcohol, you can gain weight, you can get infections like HPV, like hepatitis B. But the non-modifiable, you can't change your gender, you can't change your race, you're an African.
Yeah.
You can't change your age as you grow old as well. So those are some of the things that now usually impact more on how the cells are going to behave. So that's why you will find somebody who is very lean and they've gotten some maybe lifestyle diseases like diabetes, and you ask how. And you find somebody who is a little bit built up, but they don't have those kind of lifestyle diseases.
Yeah,
Yes.
true,
So
it's
it all
very true.
depends. It all depends.
With your
Yeah.
DNA and your
With your makeup,
the
yes,
traits
yes.
that you have from either your parents or
Yes,
whatever
yes,
you've been
yes,
consuming.
yes.
So, okay, as we wind up, because we don't want to take much of your time, because you've understood what is cancer generally, what are the approaches or how to manage cancer? How do you manage cancer generally?
So we also usually approach it in a broader way. It's so broader. Remember, cancer doesn't just come.
Yeah.
Okay, I've explained cells can mutate because of those modifiable factors.
Yes.
So remember, we can always do what we call prevention. You can prevent smoking. You can prevent taking alcohol. You can prevent yourself getting infections through maybe vaccination. Do you know there are cancers whereby you get vaccinated?
I think that's something people don't know. I think you need to. Yeah, we're going to discuss about the different cancers that we can get immunization so that you can prevent yourself from getting them, even if it's from whatever you're taking or different ways, right?
Yes.
Okay.
So that was on prevention. Then we also have screening. And that is why every month has a particular cancer that belongs to that particular month. January we have cervical cancer. September we have prostatic, like that. So that is creating awareness. Yes, we have these diseases, but they can be detected early through screening. So like what we usually have, breast cancer. When you're taking a shower every day, you're able to massage your breast, you can feel lumps and so on. Cervical cancer screenings, prostate cancer screenings. In developed countries, we have whereby patients usually have a mandatory endoscopic screenings. All those. It can be clinical, it can be self kind of screening.
Next time, we're going to discuss more about the different ways of treatment and how we're going to, and also screening and so much more. But before even we finish this whole thing, I'm going to ask Daktari something I know many people are afraid.
Let me interrupt. In terms of the approach, I said we have prevention, we have screening, we have diagnosis, and we have treatment and palliative care. So I think we are going to be on more on that because each is a unit and it's very broad and we can still discuss.
Yeah, we're going to do that. So stay tuned and continue subscribing to our channel. But before we even finish this thing, I'm going to ask something that no one asked. I think people are afraid of. But I've had clients asking, like, if a man does not ejaculate for long, do you think, is it a myth? Like, does it lead to prostate cancer?
I know that's something that is in the public now, having a lot of discussion. I will answer that in the next episode.
So stay tuned because we're going to discuss next time if it's true or not, and even more about prostate cancer. Dr. Alex is located in St.Mary's Medical Center. It's located in opposite Thika Bazaar, that is Mukuli House, ground floor. So in case you want to get all his services, you can come here and approach him and ask
get more
consultation from him, right? So thank you so much and subscribe and stay tuned. Bye.